Good morning, everyone, and welcome to Haran's Self-Funding Educational Series. Thanks so much for joining us this morning via webinar. I am incredibly excited this morning to wrap up our series with Self-Funding 301, focusing on what doors this strategy is going to open for your plan. My name is Nicole Tedford, and I'm part of the account management team here at Haran. As an account manager, I'm the guardian of your plan and supporters of your culture and your employees. We are champions of your benefit strategy. Our Haran's holistic approach to address the many different elements of your healthcare benefits program allows us to think outside of the box and develop better ways to manage your financial impact, maintain your culture, and improve your employee engagement and satisfaction. We have an entire panel in the room today here to talk about this awesome strategy of self-funding, and to help us open up the doors we've talked so much about over the past two sessions. More to come from each of them, but we wanted to make sure we give you a face to the names you're going to hear from as they walk through each of their expertise pillars in self-funding. Before I start today's webinar, I wanted to take a moment and introduce this week's fundamental, be curious. Haran has 27 fundamentals that guide our way of life and what we do for our clients, our colleagues, and our community. Be curious is the driver of this educational series, as we know how important it is for us to search for the best solutions for our clients and challenge and question what we know and maybe don't know. So let's get curious together and dive into Self-Funding 301. This is the last stop on our self-funding webinar series. We've talked through the basics of self-funding and dug a little bit more into those basics and key areas. And today we're going to take a look at self-funding through a little bit of a different lens as we look at several pillars that you can really use to support your strategy of self-funding. And just as a reminder, if you were with us over the past two sessions, the real objective of this entire series is to not only teach the fundamentals of self-funding, but also discuss some of those innovations and creative solutions and help you walk away with being able to answer, is self-funding a good and right strategy for your organization? And that's really our objective of this series as we wrap it up today. All right, a quick housekeeping item or two before I turn it over to our experts. In order to qualify for CE credits today, continuing education credits, we will have 3 keywords that you will need to email to Chris Huggard, email address on the screen. We will have keywords right now. You can see at number 1, innovation, also in the middle and then at the end of the presentation. So take a moment to note this and make sure you keep this list handy. Please email these words to Chris by the end of the day tomorrow, which is Thursday, June 26th. And then after you've sent those words over to Chris, you will receive an email with your certificate. One last point before we get going is that you can submit questions or ask for clarification using our Q&A panel. We will, of course, reserve time at the end to review those, but if there's something that needs immediate clarification, we can also address those as we go. If the Q&A panel is not immediately available to the right of your screen, there's an icon at the bottom of your screen that will allow you to open the panel should you have a question. All right, housekeeping done. Let's go through our agenda for the day. So I talked about the pillars that we're going to use to talk through today's agenda. First, a quick recap, and then we'll dig into those pillars around creative marketplace option, claims management. We'll touch on some more administration pieces, and then wrap out with what I think is the best topic, compliance. And I didn't get a giggle from Diane in the room, so all right, it's early still. All right, so with that, I am excited to welcome back Dacre from our Haran Analytics team to talk through the recap of the past sessions.
Yeah, hello everyone. For those of you who have not already met, my name is Dacre Monroe. I'm a financial consultant with our financial analyst team here at Haran. We are a team who's on mission to understand and control your healthcare costs. And we do that by distilling the story of your data down into a story that you can understand and make decisions on. So I wanted to take a quick few moments to recap 101 and 201 as a refresher for those who were with us in the past few sessions, as well as get you up to speed in case you weren't. So it starts off with talking about some of the self-funding buzz or benefits around self-funding. Some of those benefits really focus around the financials. So the biggest one we talk about in bullet one is just retaining the funds not spent on claims. The idea here being that as a self-funded plan, the employer is now the one taking on that claims liability and ultimately directly benefiting from a favorable claims year. There's also some savings on taxes and fees, as well as paring down carrier profit. There's also some savings in the first year due to the claims lag, and Horan recommends using that savings first year to build a reserve. And again, that reserve is meant to help you to manage the claims fluctuations throughout the future plan years. There's also additional flexibility in your data and your plan design. With the data, it comes down to you have more detail in your data now that you're the owner of the data, and ultimately we're able to use that data to ultimately build out better plan design strategies and achieve better outcomes. You also have more flexibility in your plan design also to build out more tailored, customized plan designs for your population and for your organization. And lastly, there's an ability to partner with a wider selection of vendors and carriers. The idea here being that now that you're the one covering those claims costs, there's additional vendors to help you manage those claims costs, and they're more relevant to a self-funded plan, and those open up under a self-funded plan. Next, we talked about some of the components of a self-funded plan and a fully insured plan, how they are similar and are different in some ways. A lot of similarities here. You see that there's administration costs to cover claims adjudication. There's also costs in the form of stop loss to provide protection against individual high-cost claimants, as well as provide a ceiling of protection. And lastly, the biggest difference here is the claim spend. Again, now that the employer is the one covering those costs are paid out of the employer's bank account, and the employer is the one that's holding those reserves instead of the insurance carrier. And with that, there's the cutting down of the carrier profit in that bucket. Lastly, you might notice that there's no taxes and fees on this page. The paring down of that carrier profit as well as savings on those taxes and fees ultimately results in potential savings for an employer. So some of the key takeaways from Self-Funding 101 were around risk tolerance and stability. It's important that as an organization you analyze your risk tolerance and stability of the organization as a whole to be able to understand if you have some of those characteristics that lend itself well to self-funding success. So we talked about stability in your cash flow, in your demographics, as well as your claims experience. We also talked about timing and consulting expertise of Horan to help guide you through really deciding when the best time to make that transition to self-funding is. And Horan is here to help guide you through and make that transition at the best possible time. We also talked through some of the tools for evaluating self-funding viability. Started with that self-assessment, some of those questions that we asked around the stability of your organization. Some of those questions included, are you able to pay claims on a weekly basis or have the cash flow to support that? Do you crave flexibility in your decision making? Do you feel comfortable with some of those additional compliance requirements that come with a self-funded plan? Maybe you've gone through that process, and really the next step is gauging financial viability. We do that by a self-funded retro analysis, which is a look back at your data to say, would there have been savings under a self-funded plan? Not only do we look back, but we also look forward through a self-funded projection, and that's meant to project costs for the upcoming plan year under a self-funded plan. The good news is that we're not just here to help you through ultimately make that initial transition, but Horan's consulting expertise is really able to shine once you actually make that transition through our additional practice areas that we're going to talk about today. So some of the key takeaways from 201 were around claims management. So now that the claims are the biggest portion of your overall spend and that you have a direct vested interest in impacting those additional vendors that we're going to talk about today are even more relevant for a self-funded plan. Financial discipline is also really important for a self-funded plan because you have to be able to budget effectively, build and maintain reserves to cover those claims fluctuations, as well as purchase stop loss at an appropriate level to protect your budget. It's also important to compose your team in a way that covers some of these additional roles in a self-funded plan versus fully insured. And lastly, we talked about her analytics. Again, now that a self-funded plan has ownership of their data, you're able to unleash the power of her analytics for your organization, which ultimately helps you build out better benefit strategies, more effective strategies to achieve better outcomes. So, notice through a ton of information at you guys really fast. Hopefully that gets you guys up to speed quick. Hopefully that'll help us to set up today and talk about some of those additional practice areas.
Great, thank you, Dacre. I really appreciate the recap and getting our minds turning this morning as we probably all sip on some coffee and get a little caffeinated as we get to dig into the next portion of our webinar today. And really the meat of it is digging into these expertise pillars and these platforms that Dacre talked about. And first up is Steve Ash talking through our creativity pillar. So Steve, you want to introduce yourself?
Yes, good morning, everybody. My name is Steve Ash. I'm the Vice President of Account Management, so I oversee the account management team. The account management team is the team that is going to help you and hold your hand to get you to that self-funding phase if and when you decide the time is right. I've been at Horan for nearly 13 years now, and I kind of grew up in the larger self-funded space, so I feel pretty fortunate about that because with the self-funded groups, as you know, there's less constraints, so it can allow you to be creative, which is why I will be talking about the creativity pillar. So thank you for having me this morning. As you get creative, you can positively impact claims, and as we all know, that's going to go to the bottom line. So at Horan, we pride ourselves on innovation. We even have an innovation team, and that's because there are so many products and strategies that are out there, we really have to have somebody to vet them. As you can see in the graphic, there are a lot of things to consider and even more areas that you can improve when you're self-funded. A few things about our approach to innovation is we're typically not going to talk one product. That is because there is no silver bullet, or else everybody would be doing the exact same thing. We take it upon ourselves to consult with you and provide a broad overview of all the marketplace solutions and making recommendations when necessary. We really like this approach because you may have heard something in the past, you may have had a boss ask you a question. So if we're taking it upon ourselves to make sure that you're well-rounded with all the different marketplace solutions, you're going to feel more comfortable in your seat and to ask us questions if and when you hear of something else. Another thing is we are carrier agnostic. We really take this approach because ultimately being agnostic is going to benefit you and your employees. And Nicole, I know you have a ton of experience in the Ben admin system, which is probably one of the biggest reasons we remain carrier agnostic.
Yeah, and that's actually a perfect example of our approach to partnering with different vendors and, partners in the marketplace is benefit administration and HRIS systems. We know that there are so many different ones to pick from that what makes it really neat is you get to pick the best one for you and the best one that fits your culture, that fits your needs, and that fits exactly how you need to administer your benefits. And that might be through your payroll system. That might be through a standalone partner, or that might be through maybe a carrier solution. So benefit administration systems, the technology that supports administering your benefits, is a really good example of how we remain carrier agnostic and find the best approach and solution for our clients.
Exactly. We want to find the product, tool, or resource that's really going to align with your benefits and business goals and objectives. So the last thing I'll say before moving on is sometimes strategy is a tool. Sometimes it's a new benefit or a product, and that may require a fixed cost or a per employee per month fee. Sometimes a strategy is the structuring of your plan. You may simply increase the ER copay to help drive better utilization at lower cost alternatives, which will in turn lower your claims projection. Sometimes you may structure your plan to cover diabetic drugs at 100%, which will ultimately increase your claims projection, but hopefully the long-term goal of that strategy is you're going to improve the health and drug adherence of your diabetic population, ultimately reducing claims. But regardless of the strategy, it's typically going to impact your members. Some strategies are going to impact them more than others, but that really needs to be considered to make sure that strategy is the right fit for you and your organization.
So what are some of those strategies, Steve?
Well, we'll go over a few. As you can see up here, we have several of those listed. We picked these just because these are either piquing interest at our clients, they're somewhat noteworthy or advanced, kind of outside the box, or we've had success with them at our clients. The first one is genetic testing. I'd probably say this is one of our most advanced strategies that's out there right now. Some of you may have heard of genetic testing as a way to try to curb costs and improve employee adherence to medications, but ultimately what the genetic testing is, it's a DNA test to help your members and your employees understand the medications and the dosage based on their genetic profile. So as we know, people react differently to medicine. So the ultimate result of this DNA test is going to eliminate trial and error spending and hopefully improve member experience and adherence, which will ultimately improve the treatment of that condition and hopefully lower claims costs. The next couple of companies listed, that's going to impact your musculoskeletal spend. So when we're looking at claims and utilization data, most of the time musculoskeletal is going to be the #1 spend at our groups, and it's very rarely ever out of the top 3. And musculoskeletal spend can be tricky because it's a hard diagnosis to impact, but we have found these 2 companies can do just that. The first is Oxford. Oxford has a national reach, and they will actually place employees on site to evaluate your people, their working conditions, any sort of habits they may have with working on the line, picking up boxes, whatever it may be, and they're going to discuss an injury or a soreness with them before it becomes serious and try to improve that. The other thing Oxford is able to do, and what we love, is impact the workers' comp claims. So we love that strategy because not only can it impact your benefits, but it's going to expand beyond that and then reduce those workers' comp claims, which we all know can be expensive and costly. The next is Arosty. Arosty is a little different than Oxford because this is a company that will impact a musculoskeletal claim after the condition has already been incurred. They are going to treat this condition and try to eliminate the possibility of surgery. The other thing they're going to do is they're going to help that patient with that chronic pain to understand how to keep it at bay. So if it ever flares up again, they know the stretches and the things that they need to do to eliminate that. And again, hopefully avoid surgery, which we all know can be very costly.
One thing that I really like about both of these partners and how we've seen them be successful at our clients is that they don't just have one solution that they go out to and they present. For example, Arosty actually partners with some of our clients that are school districts, and they have tailor-fit a program for their bus drivers, and they call it transportation behind the wheel, and really helping to address a very specific situation and working environment that our clients might have, and it's been incredibly successful, and we've had great feedback. So that's really personally that I see these 2 vendors and 2 partners be really successful.
Mm-hmm. Yeah, we've had great success stories with Arosty where we introduce somebody to them. They've had a chronic pain for 20 years. They go to Arosty and they're able to fix it. Now, they can't fix absolutely everything. They're not magic. But we have had some really, really great stories and great feedback from some of our clients, again, about chronic pains that they can now fix and they can live a better life. Third on here are the employer clinics. This is a pretty hot topic. They've actually been around for several years, but you typically see this with larger employers, typically at least 500 employees or so, which that is a big barrier to trying to get a near-site or on-site clinic. Again, you need about a minimum of 500 to get that ROI, so that eliminates the opportunity for a lot of our clients to ever participate in one of these. With the near-site and on-site clinic models in the past, there have been upfront costs that are just typically too expensive because you need to create a new building or build a new building or build out an existing space. We also found that sometimes there's employee perception about the employer owning the clinic with their logo on it and having that data. And the other thing we found with on-site and near-site clinics is a lot of times there's only one access point. Our Health is a model that we found eliminated those barriers. Our Health owns the clinic, and the employer would pay a per employee per month subscription fee to have their employees utilize their clinic. And only employers that sign up for the Our Health model can send their employees there. It's not anyone off the street who can go and utilize this clinic. The other great thing about the Our Health model is as membership grows, they will build additional clinics, so now employees have multiple access points. There might be a clinic near where they work, or there might be a clinic near where they live. And since the spouse and children are included in that per employee per month fee, it's a great model for increasing that utilization. Utilization is also driven because people with a traditional healthcare plan, there's going to be no cost of benefits for the employees that go there. If you're on an HSA, it's going to be a modest $25 to $30 payment for any non-preventive services. The services that are done at Our Health are typically primary care, some specialty type services that can be done at an urgent care. And what we find is as you carve out these costs from your traditional medical plan and you pay for them through this PEPM model, you're going to overall reduce your spend and get better care. The Our Health model is one of which the doctor is going to spend 20, 30, or 40 minutes with that patient to really do more of a holistic approach and really what primary care used to be. Again, the ultimate goal of these clinics are to drive down costs on your traditional plan through self-funding. The next piece on here is reference-based pricing. One of the big drivers of that, or leaders of that, was custom design benefits. And then you also have direct contracts, which is ELAP. And Nicole, I'll let you briefly touch on the reference-based pricing piece, and then I can get into the Elite Health on direct contracting.
Of course. So reference-based pricing is a really unique way to approach how a plan pays for services and pays for claims. What the concept of reference-based pricing is that it's a health plan strategy where a plan will pay a fixed amount or maybe set a maximum price for payment for different medical services. There's a couple different models, but the most common one and the one that Custom Design Benefits product TrueCost has approached the market with is a Medicare plus direct contract. So two pieces to this. First, you have the reference-based pricing, and that is where you pay for your services, your medical services under the plan at a Medicare plus a certain percentage. So instead of paying based off of total charges and then discounting that in the way that a traditional health plan might approach a contract, what reference-based pricing does is they actually set a base amount, which is going to be Medicare pricing plus a certain percentage. Typically, we see that percentage at about 40%. And the reason that reference-based pricing works for some clients is it allows them to, again, instead of setting it based off of the top and discounting down, they set it off of that base and then add a small percentage on top of that.
So in this instance, the reference is Medicare.
Yes. Yeah. TrueCost, Custom Design Benefits TrueCost product also adds in this concept of direct contracts where an employer actually contracts directly with a hospital system to set a maximum price that they will pay for services within that system itself. There are several other types and approaches to reference-based pricing. You can have a reference-based pricing plan without a direct contract. You can just simply pay based off of a reference. You can also add in some bundling aspects to these plans, which I don't want to get ahead of myself because that is last on our list.
So due to these plans and the way that they make these payments, the Medicare Plus portion, there really are no networks. So employees can really see any provider, any facility. As Nicole mentioned, there are some direct contracts within some of these plans. So if you go to a direct contract, there is no chance of a balanced bill because there is an agreement and a contract in place. However, if the employees do go to somewhere that is not a direct contract, there is a possibility of balanced billing, but the TPAs are typically equipped with a concierge service to assist members in navigating through this and to eliminate any sort of balanced billing. The other piece on these plans is they are copay plans, so from an employee perspective, they can appear pretty rich in the benefits. Nicole had mentioned direct contracting. So Elite Health is a direct contract model, and they tier their benefit plans. So by tiering your benefit plans, you are structuring your deductibles, copays, and out-of-pockets in a way to steer people to these direct contracts. Elite Health is made up of St. Elizabeth, Tri-Health, and Children's Hospital. So if a member were to visit one of these hospital systems, they would have a lower deductible than if they wanted to go to, say, Christ Hospital. So for example, you may have a $500 deductible if you go to St. E's. If you choose to go to Christ Hospital, you may have a $1,000 deductible. So you structure and tier your benefits in order to drive utilization to the direct contracts.
And by the way, you want to do that because as an employer, if you have a direct contract with a facility, you're likely getting a better deal for the services done there. So remember, all of these products are around innovative ways to control your claims costs.
Exactly. The next is Bind. We talk about Bind because this is a really unique way to purchase care. It's really on the forefront of innovation. We had recently held a seminar on Bind, really just due to the uniqueness of the plan. It really shows you where technology may be taking us and how it can improve employee utilization of the plan, purchasing of the plan, as well as consumerism. So at a very high level on Bind, employees purchase a core medical plan. That core medical plan does not have 33 services included within that plan. So an example is a knee surgery or knee replacement. When you purchase that core plan, a knee surgery or knee replacement is not included. It's one of those 33 excluded services. So I'm sure some of you are saying, okay, you may not know you need a knee replacement. So what happens in July after your plan renewed 1/1, they bought the core plan, you need a knee replacement. Well, what's going to happen is the employee is going to go to a provider. They're going to let them know they need a knee replacement. That's a procedure that needs a prior auth through the medical carrier. So they will try to get the prior authorization through Bind. Bind will tell them this is not covered. So what the employees do is they go to their app, they see this is not covered, and at that time, they purchase coverage for that knee replacement. Now, the thing is, when they purchase coverage, it will show them the various costs between different hospital systems. So, for example, if they want to go to hospital ABC, it may say you will owe an additional $1,000 in premium, and you will have a copay of $500 to get your knee procedure done at that hospital ABCD or ABC. You can also go to hospital XYZ, and you will have a premium of $500 with a copay of $250. So me as the consumer, I will see that that is a lower cost, still high quality option, and I will choose to add that knee procedure through that facility. So ultimately, the app and the tool is driving you to the lowest cost option for that procedure. If there is say at that first hospital system, it on the back end hits your claims as $40,000 compared to going to the other hospital system, and it's going to hit your claims as $20,000. By having that embedded within the app to steer people to that lower cost option, you just saved the claims $20,000.
That's a lot of money.
It's a whole lot of money.
For tiering and steering people to the lowest cost option.
Exactly. So it's a really cool tool. It's built-in consumerism at the time of purchase. It's also for general services. So if you needed an allergy shot and you wanted to look that up on the app, are allergy shots included? It would pop up and say yes, and here are your options. You can go to a little clinic and it may cost you $30. You can go to a specialist, it'll cost you $50. Primary care, it'll cost you $20. So it's going to steer you, again, to the lowest cost option, even for the day-to-day services. So as we all have smartphones and we all love apps, this is kind of that product that's on the forefront of purchasing a medical plan. The last strategy I'll discuss, but obviously not the last one that is out there, is bundling. So Nicole mentioned bundling before. You may have heard of bundling as well, but really to put it simply, what bundling does is you're going to steer your members to a certain provider, for example, Beacon, by, again, tiering your benefits in a way that will drive a volume to that provider. Therefore, that provider is going to give you reduced cost for that service. Services such as knee replacements, hip replacements, shoulder surgeries are some of the most popular that have come under this bundling program. And again, to the example I gave, if you can steer somebody to go to an outpatient facility that may cost $20,000 for a knee replacement compared to a possible hospital where it may be $40,000, that is a huge savings to the plan. So you tiering those benefits to say, hey, we'll cover your deductible if you go to, for example, Beacon. You picking up that $3,000 in the front end to ensure that they go to that lower cost option that, for example, may have a $20,000 delta makes a lot of sense not only for you as the employer, but also the employees. So we've had several clients put these in, and it's an extremely well-received benefit from the employees, particularly in the market today where it's really hard to recruit and retain and reward employees.
Great, Steve. Thanks so much for taking us through some of these innovations in healthcare and some of the different benefits and products that we're seeing out there. Really appreciate it. And want to move on to our next topic. Actually, I'm sorry. Keyword number 2 for the day is wellness, which, funny, it's like I wrote these keywords, sets us up perfectly to talk about our next pillar. So note the word wellness. And with that, I'm going to turn it over to our claims management pillar and our expert in this, Raquel Sanchez.
Hello, everyone. Great to be with you. Again, my name is Raquel Sanchez. I'm our Health Management Director here at Horan, and my role is to consult clients on best practices and innovative strategies around health management. So we work hand in hand with our clients and the account team, our data analytics team, to develop custom recommendations based on what an employer's goals are and objectives around how to improve health outcomes. One of the things that you may be wondering is, how does this intersect with claims management? Seeing as I am the health and wellness guru for Haran, and that is an area that I focus on primarily with our clients. Well, one of the things that we know is essential in self-funding is claims management and wanting to be good stewards of the healthcare dollars and the spend and keeping employees healthy and engaged. We know this as claims are incurred monthly, you're able to see the bottom line very quickly, and as employees adopt healthy behaviors, we're able to make this strategy long-term and have sustainable results in terms of the claim spend and the overall health management strategy. So part of our conversation today is going to be wellness focused with an impact to claims. All right. So what you see here is our health management continuum. This is our proprietary consulting platform that we use to consult with our clients. And essentially what we do here is we work with you on first completing an assessment to get a good understanding of your culture, your goals and objectives with your health management strategy so that we can better understand what levers we have to play with and adopt a strategy around. This continuum works from left to right, with Inform being the first phase and Game Changer Trend Bender being our advanced clients. So for each of these phases, we have a specific strategy, communication, style, incentives that we would recommend to get the most success out of each of these phases. One thing to note here, as you build your health management strategy and really build in aggressive incentives, a robust communication, drive high engagement in your population health, you'll begin to see a correlation with your claims costs and the engagement levels of your population. Another way to say that is how engaged employees are in your wellness strategy is going to have a direct impact on your claim spend, because we know healthy employees are going to be less costly.
Great. Thanks, Raquel. So talk us a little bit about some of the trends that we're seeing in the world of health management.
Yeah, you know, it's interesting. We launched this Analytics Data Bites in the fall of 2018, and really with the intention of understanding what are the marketplace trends and what actions employers can take to lower risk and associated costs. So for today's conversation, I'm going to take us through some of those highlights and key takeaways from our Data Bites and how those can be applied to the workforce. So our most recent Data Bite, and some of you who are listening might be familiar with these, was around the primary care physician visit and the importance of the impact this can have in your workforce when we look at, from a cost perspective, the 11% difference in annual claims associated with someone who gets their annual physical and someone who does not. So 11% is significant when you compound that from your employees and spouses who can be getting that on an annual basis. And when we look at the average book of business for not only Haran but our carriers, the average employee who gets their physical is 30 to 40% of the workforce. So there's huge opportunities in terms of building a strategy and incentive around encouraging employees to go see their PCP, engaging them with that relationship with their primary care so that that's their first place of contact in place of an urgent care or ER, and really just driving that awareness piece, because we know that if you're getting your annual physical, you're going to get conversation around age and gender appropriate screenings, conversations around medication adherence, and that's going to lead to better health outcomes in the long term. So with that, you will see here the impact that it's having not only on a preventative side with that relationship with your primary care, but with the referral process, we're seeing lower costs associated with additional conditions relating to musculoskeletal, cardiovascular, gastrointestinal, and cancer. So the ripple effect that this strategy can have can be very impactful, which is why we strongly recommend this, not only for employees, but you see here on the right, spouses. This was something that was surprising in terms of the significant impact that it has. We know that spouses typically are more costly, but this data is showing us that it's 21% more costly when spouses do not get their annual physical. So again, just reiterating the importance of building a strategy around awareness, early detection, and prevention around getting your annual physical, both for the employee and the spouse. I will note that there are a number of vendors that can help build that strategy in and make it very turnkey.
Yeah, great. So primary care, obviously incredibly important. As we talk about health management and wellness, specifically as it relates to the strategy we're talking about today, self-funding, all around impacting claims. Of course, we want to keep our human hats on, and we know that preventive care is important for a lot of reasons. But as we talk about the financials behind preventive care, it really does show that if you can engage your population in preventive care, it has an impact on claims. What else have we found through these data bites, Raquel? What are some other things that we've been able to uncover?
So the next one that we took a look at was around hypertension. And as you see, just the cost associated with a member who has no cardiovascular claims and 3 times more costly compared to those who have cardiovascular claims. So again, here, in terms of claim management and controlling costs of the plan, population health, what can we do to have better health outcomes and control the spend of our self-funded plan? We really need to build strategies also around hypertension awareness, and that can look like a number of things. For this specifically, there's some easy out-the-gate strategies, such as having a blood pressure monitor system in your break rooms. You can work with your carriers on resources to promote. Also working with a third-party vendor who can come on site and do blood pressure screenings, lunch and learns, and working with the American Heart Association are some other strategies there. One thing that I like to note here with this is we know that diabetes is a high-cost claim, and in doing a little bit of research, 80% of type 2 diabetics also have high blood pressure, and we know that when this is left untreated, it can lead to diabetic eye disease and kidney disease. So we shouldn't just isolate this into just blood pressure. It really has such a compound effect, and so it's really important that people are aware of the risk factors, because oftentimes we don't know when we have high blood pressure.
You are the health and wellness guru. I love it. What else?
All right, so this is the last one that I want to round out this conversation on claims management. This was our first data bite that we launched with, and this one is around mammograms and the significance of early detection and prevention. We all know somebody who may have been diagnosed with breast cancer or who was able to catch it early through early detection and surveillance, and because of that, they were able to be treated. And that can lead to significant cost savings, not only for the employer, but also for the employee. So there's 2 hats to the story here. Breast cancer is the #1 cancer in Haran's book of business and the #2 in outpatient costs. So the strategy around this area is, again, just promoting surveillance. So can we get a mammogram van out from a hospital system to come on site and do breast cancer screenings? Can we send some targeted mailers out, have a Women's Health Day where we can really promote this? Again, from a claims management perspective, it's important that we understand the data, that we take action using plan design and incentives to drive employee engagement so that they know their numbers, they're engaged with their PCP, and they're getting those age and gender appropriate screenings.
Great. Thanks, Raquel. All really great information, and hopefully energizes you to understand how health management impacts claims management directly. Our next pillar is our administration pillar, and you get to hear a little bit from me on this, actually, as we dig into the different administration components of a plan. We discussed a lot of this in 201, but we just wanted to round this conversation out and taking administration of your self-funded plan to a little bit of a new level. The key thing to remember is that it is time to get prepared to be more engaged in your plan. You just heard from 2 of our experts, Steve and Raquel, on all the different ways that you can engage in different components of a plan, whether it's tapping into new innovations, having a robust wellness program, and all of that just takes a little bit more engagement from your team. In order to set yourself up for success as a self-funded plan and to take advantage of, well, the advantages of self-funding, Getting your team excited about this engagement and excited about the management of a plan is really important. So 3 different ways to go about administering and getting excited about this plan is, first off, just as you've heard us say again and again, know that you're not alone in administering this plan. You have experts as your guide with your Haran team, and we're here to help you be curious and be curious for you, learning about these new innovations to bring to your team, to you, and to your plan. We're also here to help through the innovation and implementation, and ongoing plan management, helping you to set up your internal playbook to manage your plan. This playbook ensures that your team is aligned and ready to administer and manage the plan, get engaged in some of those wellness strategies that Raquel talked about, learn about those innovations that Steve walked through, and anything else that you need to be successful in your self-funding strategy. So we didn't want to spend a lot of time on administration because, again, we talked a lot about it in 201, but the key to this is, number 1, you're going to be more engaged in your plan, and that's really exciting, I think, because you get to learn so much more about how to make your plan the perfect fit for your culture. And with that, I want to turn it over to our last pillar, compliance.
Thanks, Nicole.
And got Diane Cross here to talk through this. Diane, welcome.
Right. Thank you. So to piggyback off of what Nicole was saying and administering your self-funded group health plan, part of that, like with most things employee benefits, is compliance. So here we have the pieces of the puzzle fitting together. You have financials, claims management. It makes sense to transition to self-funding. It's important in the excitement in that transition to take a pause and think about compliance. Good news, folks. Most of these responsibilities and requirements apply similarly, whether you're fully insured or self-funded. But there are some requirements that might look different when you're administering a self-funded plan. And that's what I'm here to talk to you, a brief overview of today. But by way of introduction, I'm Diane Cross, as Nicole mentioned. I'm a member of our compliance team, and our role here at Haran is to continually develop our expertise on regulations that impact employee benefits, which we all know are always changing and can be quite cumbersome to navigate. So in my role, I help advise and educate so that we can all operate compliant employee benefit administration.
Great. Let's dig into it.
All right, so as promised, I would like to give an overview of some of the considerations that a self-funded group health plan should keep at the forefront as it relates to compliance. And what I will talk to you today about is a little, some big and little requirements under ERISA, HIPAA, the Affordable Care Act, and non-discrimination rules.
Dan, I do want to say before you dig into this, we understand that compliance is a really big part of your health plan, and also know that you're not going to know exactly what to do based on today's conversation. So as you dig into compliance and as you dig into a self-funding plan, know that Diane's team and your account team at Haran are here to hold your hand through compliance, not only through implementation, but also after you get your plan up and running. So I just wanted to caveat that with, we know you're not going to walk away being experts on these subjects, but there are certainly considerations that you should have in the back of your mind as you walk down this path of self-funding.
Thank you, Nicole. I could not have said that better myself. And so the purpose of these next few minutes that I have with you, sometimes a brief overview can create a little bit of anxiety. So to that point, keep Nicole's words in mind. So moving on, ERISA requires a certain sense of fiduciary responsibility. I find in talking with clients that fiduciary responsibility tends to be an intimidating word. But let me unintimidate that for you if that's a vocabulary word. If not, we've just made one. It really means to act in the best interests of the participants and beneficiaries. So for that being said, in a fully insured plan, the insurer is responsible for how the money is spent, the claims and appeals, utilization review, pre-certification, and functions related to benefit approval. When you transition to being self-funded, the plan sponsor or the employer will then pick up some of those fiduciary responsibilities.
The point of this slide and this topic is to bring it to your attention that you have increased fiduciary responsibility as a plan sponsor of a self-funded group health plan. And what does that really mean? How does that impact you? It means that when you're making the decisions, you're not necessarily making business interest decisions. You are making the decisions in a prudent manner in the best interest of the participants and the clients. Participants and beneficiaries. I also want to reiterate that this requirement isn't a change. This isn't a new requirement. It just looks different, and the responsibilities shift a little bit different depending on funding. Also under ERISA, as you may know, there's a requirement to operate your plan in accordance with a written document and a summary plan description. Now, I should put the caveat that this requirement are for those plans who are subject to ERISA. This requirement, again, does not change. However, it shifts a little bit on how it is fulfilled, so to speak. Oftentimes, in a fully insured, when a plan is fully insured, the employer will utilize a certificate of insurance or a certificate of coverage or a benefits booklet or what have you from the carrier to help in part meet this requirement. When you're self-funded, you don't have that core piece to help create this requirement, and ultimately the employer is still responsible. However, good news is that many employers still choose to hire a third-party administrator to assist with this task, but on the onset, you don't want to be caught surprised to say, hey, where's my benefit booklet or certificate of coverage? I thought I had met this requirement, but oh yeah, we switched to funding, and now it looks a little bit different on how I meet this requirement. On to HIPAA. HIPAA is a very important topic. I happen to think all things compliant are super important, but HIPAA would be a really, really important topic when you're discussing compliance considerations for a newly self-funded group health plan. What happens here is that when you transition to self-funded, you have increased access to protected health information. Here enters HIPAA to provide some protections to those, to the protected health information. Now, I'll say from the onset that this impact to the employer can seem like a daunting laundry list, so to speak, but rest assured, with the proper support, and HRAN's here to do that, or provide recommendations of folks who can be easily implemented and maintained with the right guidance. So where HIPAA comes in with a self-funded group health plan, where you may not have thought about these requirements before, is you must have a HIPAA privacy and security policies and procedures. So it starts with developing those procedures. In addition, HIPAA is going to require, among other things, to appoint a privacy and security officer, conduct a periodic risk assessment, train your workforce on your privacy and security policies and procedures, have business associate agreements in place when applicable, and prepare and provide a privacy notice. I should say that this list is not exhaustive. And again, going back to my prior comment, or two prior comments, one, it might seem like a laundry list. Thankfully, to Nicole's point, you have an account management team supported by our compliance team to help walk you through these steps. Oftentimes what we see is that it might be some work at the initial transition, and then you see maintenance moving forward. But I also want to...
Sorry, I just got a note that someone said we lost sound. Keep on talking. Maybe let me see if we've lost sound.
Okay. Well, I'm going to continue for the sake of time.
Never mind. We're good.
Okay.
Just thanks everyone for chiming in that you can still hear. Appreciate it.
Perfect. Thank you. So here's where I want to get a little bit on why it's good to follow the rules. Of course, we all want to follow the rules to be compliant and diligent citizens and follow the letter of the law, right? But with HIPAA and this requirement, it's not only important to be compliant in the event of an audit, and that the fact that penalties can stack up very quickly. But without HIPAA policies and procedures in place, a self-funded group health plan is not able to properly administer their plan. HIPAA breaches, HIPAA violations are not a matter of if, I promise you this, it's a matter of when. So having those policies and procedures is the mechanism for you to be able to navigate when those situations arise.
Great. All right. So HIPAA sounds important. Definitely want to get your ducks in a row. Let's round out this conversation with a few more topics, and then we'll get to some of the questions you guys have.
Great. Very quickly, I want to touch upon ACA. The requirement remains the same, whether you're fully insured or self-funded. But there are a few nuances that self-funded group health plans should be aware of. First, who needs to report? Under a self-funded group health plan, every self-funded group health plan must report under the ACA. And when reporting, you report on each enrollee on the plan. To contrast, when you're fully insured, you report only on full-time employees. And then lastly, a self-insured group health plan is responsible for completing Part 3 of the Form 1095-C, and that is a portion that would not have needed to be completed when fully insured because the insurer completes a similar form with that information. Also want to reiterate here that if you work with a vendor to assist you with your ACA reporting, these are all easy changes when you notify the vendor that you're now self-funded. Self-funded, yep.
Great.
And lastly, while I talked about some main considerations, I want to talk about some other things to keep in mind, such as creditable coverage and COBRA rate setting. Those are the responsibility of a self-funded group health plan. Before, you would have the insurer provide whether or not the plan was creditable and provide the funding, the amount for COBRA. But when you switch to self-funded, that responsibility is that of the plan sponsor. Something that some employers like is the fact that if you are a private self-funded employer, you are not subject to state mandates, and depending on the situation, that could create some flexibilities in plan design. And then lastly, Section 105H non-discrimination rules are under non-enforcement for fully insured plans. So when you would transition to being self-funded, those would come into play and basically boils down to not discriminating in favor of highly compensated individuals as it relates to contributions and eligibility.
All right. So we actually do make compliance fun here at Horan. Diane is really great at coming out and making sure that as you make this transition or are considering making this transition to self-funding, we are here to help. And that is something that I absolutely love about Diane and her team is that they really do make it fun. And yeah, you're welcome, because compliance is a little bit of a dry topic, but we know how important it is for all of our clients. So definitely an important piece to wrap out today's conversation about self-funding. All right, and with that, the last key word of the day is compliance. So make sure you write this last one down, send a note to Chris with all three words by the end of the day tomorrow, and she will make sure to get your certificate for your CE credits. So, feeling inspired by today's conversation, or maybe by the prior conversations that you heard between myself, Dacre, and Jen McCormick in 101 and 201, really, this is quite the exciting topic. We're happy to come out and talk to you more about this strategy for your health plan if it's something that you want to dig down and go down the path a little bit more. We do have a few questions here, so we're going to talk through some of these first, and if you have more questions, then feel free to type those into the panel. Steve, the first one is for you. It's around reference-based pricing, and just really the question is around what kind of employee education do you need to provide in a reference-based pricing world?
Yes, I would say there's absolutely more employee communication that needs to happen in education if you move to that reference-based pricing plan. we've been on kind of the traditional model for a very long time, and people are used to the way that they purchase their benefits and are not familiar with balanced billing for the most time, because most carriers will have a very robust network, and it's almost hard to find somebody that's out of network. So there will be additional education associated with that. I think during open enrollment, if you ever go down that path, it's a lot of education, meetings, and then periodically throughout the course of the year reminding them of that, because we all know that not all employees will remember what was communicated at open enrollment or read all of the materials. So you will have some employees that will not be aware when they go somewhere and may get a balanced bill. Now, keep in mind that the balanced billing is a very low percentage of the overall claims that are processed, but it can happen. So yes, I would say education is definitely warranted.
Steve, another question here for you on your topics around tiering benefits and steering employees and members to low-cost providers. What if something goes wrong there? Is the employer liable for that?
No. So the beauty about tiering your benefits is you're still giving them choice. You're not forcing them to go to this provider or a certain provider. It's just you're just encouraging them through the benefit plan design.
Great. And Diane, we've got a question here for you regarding the Affordable Care Act reporting. Just a clarification point here. Does enrollee include family members on that reporting?
It would. You would include that information in Part 3 of the 1095C form.
Okay, great, thanks. All right, well, that rounds out our questions that we've had today. And of course, if you have questions as you think through this strategy more, you know how to get a hold of your Horan team and where to find all of us. So we welcome questions. We'd love to come out and talk to you more about this strategy, but thank you for joining us today for our self-funded 301 webinar. And folks, that's a wrap on our self-funding education series. Thanks everyone so much for joining.